Good morning, everyone. I'm Dr. Nneka Onyejepu. I'm a research fellow at the Center for Tuberculosis Research that is under the Microbiology Department. And this year we're working towards celebrating the World Tuberculosis Day, which is usually held on 24th of March every year. And the essence is to put the spotlight on TB, which is a curable disease, but has been killing millions of people all over the world globally. And for statistics' sake, 2021, we had over 10 million TB cases worldwide. And of these, about 1.6 million lost their lives to TB. And so we hope that this year with the theme, Yes, We Can End TB, we want to focus the spotlight on things that will actually help us to reverse the trend of TB scourge or burden globally. And so for this year, we're hoping that there will be a collective responsibility towards ending the TB scourge by year 2030, which is the global TB targets. And for this year, we hope that there will be much more funding for research and innovation that will catalyze efforts towards the global ending TB disease by year 2030. And so for WHO and on the global stage, there's this focus on making available drugs, effective anti-TB treatments to those who are sick with TB. And of these, the shorter TB regimen for multi-drug resistant TB, which are TB that does not usually respond to first-line anti-TB drugs, as well as faster molecular diagnostics that will make sure those who have TB are detected fast and placed on treatment fast as well. And also, there's also this focus on TB infection, which is subclinical, but can lead to active TB later on in life. And so we hope that there will be a collective responsibility towards that. And so for NIMR, we are going to hold a symposium on the 22nd of March this month. And the focus is actually to look at recent advances in TB management and diagnostics. So what are the recent advances in terms of care for those who have TB disease, and also what are the recent advances in terms of diagnostics, faster, more effective, and sensitive diagnostics for TB disease. So we'll have NIMR scientists talking to us about these advances and what NIMR has done so far in terms of their contribution towards ending TB by year 2030. And I would like to mention at this junction the management. They have been very helpful, and currently we're hoping to set up a TB infection diagnostics in NIMR here, and then we're also hoping to set up the TB genomic platform also here in NIMR. The focus is to actually start using molecular methodologies, this time sequencing, in looking at TB bacilli, that's the TB germs that harbor mutations that make them resistant to current anti-TB drugs. And we're not just doing it here in NIMR, but we also intend to work with all other institutions within the West African sub-region to actually set up a TB genomic surveillance platform within the sub-region so that we can actually track these diseases, those that are sensitive and those that are resistant to anti-TB drugs. We can track it across the West African sub-region. We can keep a tab on what is happening, the evolution of these organisms, which will help us to put in targeted interventions and strategies to actually curb this disease and hopefully meet the target of ending TB disease by year 2030, not just within the sub-region, but also globally. Thank you.